Hi, this is Emily Matthews with Remax Universal, and today I'm interviewing Dr. Cheryl from Advanced Eye Care in Plymouth. So, how did you get started? Like, did you didn't come here originally? You weren't from here originally?
No, I'm from Michigan. I went to school at Illinois College of Optometry.
Okay.
And we had the opportunity to buy Dr. Richter's practice. So after we graduated, we were working in Milwaukee for a little bit. I was working at a medical office, and Tim was working at a refractive surgery clinic.
Right.
And we had the opportunity to buy the office, and that was in 1996. So we moved up and bought the practice. We practiced in our original location, which was down by the mill pond.
Okay.
And we moved to our current location right in the middle of the downtown. We moved right to our current location in 2010 after we renovated the Dairy State Bank building. So yeah, we've been here ever since.
Yeah. I don't think we weren't here. Let's see, when did we move to this area? 1999.
Okay.
Yeah, but we didn't. I don't think we found out about your office until later. So you were already here by the time we found you.
Yep. Yeah, it's been. I can't believe it's been. We're going to be celebrating our 30th anniversary.
Wow. Yeah.
I know, that's crazy.
Yeah. Time flies.
Yeah.
So, what made you decide to go into optometry?
I think I always wanted to do something medical. I wanted to have a family also, so I wanted a medical specialty that didn't require for me to be on call to an excess. And my grandfather, Frank, was an optometrist in Detroit, and I remember going in his office. And so when I was looking at the different specialties, this was definitely on the top of my list. And I went to Michigan State University for undergraduate, and I did a co-op, which kind of didn't exist at the time, but I created it. I called a local doctor, asked him, can I come in and just observe? I'll file your charts, I'll take out the garbage.
Really?
Yeah. And I just wanted to see how it felt, to see if I could picture myself working in an eye clinic, and I loved it. So I applied to optometry school. Yeah.
That was a really smart, I mean, that is so smart.
Yeah. And now, I often talk to kids that come in for eye exams if they're struggling, and I do recommend either shadowing or volunteering, because it really gives you a picture of the job. Sometimes it's so hard to picture what you might be doing, but I love helping people. I love to work with people.
Yeah, and sometimes some of the high schools now are doing that with, these programs.
Yeah, it's a lot more common.
You really have to do that because...
those kids really excel.
Yeah.
I wish, even when my kids were going through, it was just kind of starting, but I wish it was more of a thing. But they've all, the kids definitely benefit from the volunteering and the shadowing. So I've had a lot of kids that have come in and shadowed here.
Yeah.
So
a friend of mine and I were talking about how we were candy stripers back when they had that.
Yeah.
It's like, you don't realize how much of an impact that makes on you.
Yes. Absolutely.
Until much later, and then you're like,
That's probably the way that I decided I didn't want to be a medical doctor, was volunteering in the hospital and seeing the doctors come in. I used to work third shift in the neonatal intensive care.
Oh my.
And I would go home and cry. I mean, the doctors would come in the middle of the night. Sometimes they would bring their own babies, and I thought, I want to have, I want to help people, but in a different way.
Yeah, not so.
Well, I thought that would be too much of an impact on my own family.
Yeah, not so much of a, When I was doing ER nursing, I could never talk about work when we were eating.
Understandable.
To me, it was normal, but they didn't like it.
Yeah.
So, so what would you say is something that people don't usually know about you or about the practice here? That might
I think
surprise
sometimes
them.
people don't always know that we do routine eye exams, and we fit contacts, and we have a really nice selection of glasses, but there's also a medical component to our practice. So we treat eye infections. We see a lot of patients with glaucoma, diabetes, macular degeneration. We take care of patients after eye surgeries. And I have in the last probably 5 years, really specialized in dry eye treatment, and that is a growing field. There's more treatment options than ever before, and I really enjoy that. So probably the dry eye and the medical aspect, but also the dry eye has kind of led us also down the path of helping patients with aesthetics. We have some like non-surgical skin tightening options, and we brought in an aesthetics line that's like an MD grade, very good quality product. So that's another thing that has just kind of evolved over time.
Wow, I did not know that, so I'm glad you told me.
I love it, but personally, it's been nice.
Yeah. So what would you say is your plans or your goals for the future?
We haven't announced this yet, but we are planning to bring in another doctor. Our practice is growing. Continue training for the staff. We really are enjoying the aesthetics portion of our practice, and we really are enjoying the dry eye chapter. We recently brought on board an IPL machine, which is intense pulse light to treat dry eye.
Really?
And that's
I'm gonna have to try it.
It's actually it's just a wonderful addition to our practice. So I feel like continued learning, growing, and just continuing to help people. You know, we're very blessed. We have a really busy practice, and we really enjoy it. So.
Well, thank you very much for your time.
You're welcome.
This is Emily Matthews with RE/MAX Universal, here to help you with all your real estate needs, covering the Tri-County area of Calumet, Sheboygan, and Manitowoc counties. Have a great day.